It is my honor to serve as president of the Ohio Dental Association during its 150th anniversary. Since 1866, the ODA has worked to advance the interests of the dental profession, the Ohio dental patients, and the public. Back in 1866, dentistry was not well organized, and dental care was often provided by individuals with little or no formalized training. The tools were primitive, and the science related to oral health was yet undiscovered. For too many, dental care meant tooth pulling by a barber or a blacksmith. But that all changed when organized dentistry was born. Organized dentistry was the vehicle that transformed dentistry into a true profession, consistently pushing to modernize and advance both the art and science of dentistry. Today, the ODA represents more than 5,000 member dentists who provide high-quality dental care to millions of patients across the Buckeye State. Our profession thrives because we insist upon the highest standards of care, scientific-based training, and professional ethics. The incredible advancements that we have made in our profession would not have been possible without organizations like the Ohio Dental Association. And in 2016, we take a moment to reflect back upon where we've been and where we are going.
On June 26th and 27th of 1866, 41 dentists met at Naughton Hall in Columbus and developed a constitution and bylaws around the goals of creating a statewide association for Ohio dentists. The purpose of this new organization was to advance the dental profession, protect the public, foster fellowship, and encourage more formal professional education for dentists. On those warm June days 150 years ago, Ohio Statewide Dental Association, then known as the Ohio State Dental Society, was born, and dentistry in Ohio would never be the same.
After adopting the Constitution and bylaws, the leaders of the Ohio State Dental Society developed what is believed to be the first written code of ethics in dentistry. Ohio's code, which encouraged dentists to act professionally at all times and to treat patients with respect, was the model for the American Dental Association's Code of Ethics, which was adopted just a few months later.
2 years after that, in 1868, the Ohio State Dental Society worked to get the Ohio legislature to pass one of the first dental laws in America. The new law sought to ensure that dental care in Ohio was provided by qualified individuals who had sufficient training and experience in dentistry so that Ohioans could be confident that they were receiving quality dental care. Many of the leaders of the Ohio State Dental Society served on the original Ohio Board of Dental Examiners, which was created by the new law. Establishing formal dental education programs was another priority for the Ohio State Dental Society. In the 1800s, many dentists had no formal training and learned as apprentices. The Ohio State Dental Society, working with the Board of Dental Examiners and established universities, sought to stabilize and formalize dental education to ensure the art and science of dentistry was being advanced and taught competently to students. This effort led to the creation of the dental schools that currently exist at The Ohio State University and Case Western Reserve University. Today, these institutions deliver world-class dental education to their students, and along with others, their alumni make up the membership and leaders of the Ohio Dental Association.
Ohio dentists have a long history of working for the underserved. In fact, in February of 1941, the first Children's Dental Health Day in America was held in Cleveland, and a week-long Children's Dental Health event was held in Akron that same year. These events were designed to draw attention to the importance of dental health for children. Following the example set in Cleveland and Akron, the American Dental Association held the first national observance of Children's Dental Health Day on February 8, 1949, and it became a week-long event in 1955. Today, the ADA recognizes February as National Children's Dental Health Month. When scientific evidence in the first half of the last century suggested that fluoride in the drinking water prevents tooth decay, organized dentistry responded. In 1950, the American Dental Association passed a resolution encouraging water fluoridation, and over the next 2 decades, the ODA and local dental societies advocated to fluoridate water systems across Ohio. In 1969, the Ohio Dental Association successfully lobbied to have the state legislature enact a law which required most municipalities to fluoridate their water systems. Today, because of those efforts, more than 90% of Ohioans live in communities with fluoridated water systems, which is well above the national average of 70%. Because of its positive impact on oral health, the Centers for Disease Control and Prevention has declared that water fluoridation is one of the top 10 greatest public health achievements of the 20th century. The ODA helped to make the promise of water fluoridation a reality in Ohio.
In the last half of the 20th century, advancements in research on infectious diseases and appropriate sterilization in the dental office led to a better understanding of how to protect patients and dentists and their staff. In Ohio, the ODA pushed for the adoption of science-based infection control laws, regulations, and standards to ensure the provision of dental care in Ohio is the safest in the world. And today, Ohioans have complete confidence that the care they receive from their dentist is safe and effective. As the practice of dentistry has changed, so has the role of the dental team. 150 years ago, dentists provided their services with little or no professional assistance. Technological advancements and the expansion of dental assisting, dental hygiene, and EFTA education, spearheaded by organized dentistry, have enhanced the dental team, making the delivery of care more effective and efficient.
In 1984, ODA's leaders recognized that as the business and management of dental practices became more complex, a trusted source was needed to help make dental offices more efficient and effective. As a result, the Ohio Dental Association Services Corporation was born as a separate independent subsidiary of the ODA to assist member dentists with various aspects of running a dental practice. Today, ODASC offers 12 different insurance plans, including health insurance, professional liability insurance, and group-rated workers' compensation coverage, and 10 different practice management products, including patient financing and sterilization monitoring. Nearly all of these products are offered at a discount and provide unique benefits that are not available elsewhere in the marketplace. Thousands of ODA member dentists utilize these products and services every year.
I use multiple ODASC endorsed products in my office, including sterilization monitoring, bleaching gel, disability insurance, and the ProSites website development. I know I will always save time and money using these products, as they are thoroughly vetted by the ODASC board and are always best in class and price. Whenever I have a practice need, whether clinical or business, the ODA and ADA is the first place I look.
In 1995, the leaders of the ODA saw the need to create a philanthropic arm, so they created the Ohio Dental Association Foundation as an independent, nonprofit charitable organization. Through the generous support of the ODA member dentists, the foundation awards grants to worthy programs that provide access to dental care to the underserved and scholarships to worthy students in dental school and in dental assisting and hygiene programs. In fact, this year, as the ODA celebrates its 150th anniversary, the ODA Foundation will surpass the mark of awarding $1 million in grants and scholarships, further demonstrating the profession's commitment to the underserved in Ohio and the future of dentistry.
The ODA Foundation does volumes to support dental students, especially through the Dental Student Scholarship Program. As you know, dental student debt has doubled over the past decade, leaving a lot of personal stress on the individual student as they wonder how they're going to pay those loans back. I've been personally fortunate to receive support from the ODA Scholarship Program. To me, it's more than just the financial support, but the overall support that the foundation and the Ohio Dental Association gives to students like me. And I'm so grateful to be part of a state dental association that really does give back to the students in the future of dentistry.
Today, ODA members also demonstrate their commitment to the underserved by directly providing much-needed dental care. Through the Give Kids a Smile program, ODA member dentists provide nearly $1 million in free care to underserved children every year. Member dentists also provide care to underserved adults through the Dental Options Program, our innovative public-private partnership with the Ohio Department of Health. From the early days of the association through today, the ODA and its members have demonstrated a commitment to Ohio citizens. In fact, a recent independent survey shows that ODA members provide a total of more than $40 million in donated care to underserved Ohioans every year. This commitment is one of the reasons dental patients and the public continue to trust and respect the dental profession.
The ODA annual session is one of the longest running annual dental meetings in America and is an excellent source of information, resources, and fellowship for Ohio dentists. Every year, dentists and their staff have access to the highest quality continuing education from nationally known speakers who come here to Ohio. And dentists can shop for equipment, supplies, and other dental-related materials in one of the region's largest dental exhibit halls. The ODA annual session weekend also includes dental school receptions, specialty meetings, and other opportunities for fellowship and reconnecting with colleagues. All this is why the ODA annual session continues to be one of the most popular state dental meetings in the country.
Today, the ODA is one of 53 constituent state and territorial dental societies of the American Dental Association. And Ohio has 25 local component dental societies. This tripartite approach of local, state, and national membership makes organized dentistry unique and effective in advancing the dental profession. And within this tripartite system, the ODA is recognized as a leader in advancing dentistry.
At the ADA, the Ohio Dental Association is regarded as a leader in promoting our dental profession through our dental advocacy and our innovative programs. The Ohio Dental Association is truly a role model for other state dental associations across this country.
Our membership surveys reveal that the ODA is an organization that is meeting its member dentists' needs and expectations at an amazingly high level. Members value the products and services offered through ODASC, the discounted CE opportunities offered through the ODA annual session, and the leadership development training offered at the annual ODA Leadership Institute. ODA's publications, both electronic and paper, rate as highly valued sources of important information to help members keep track of trends in dentistry and changes in dental regulations and in the dental marketplace. The ODA staff is a friendly and reliable professional resource providing accurate and up-to-date information when dentists need assistance on legal, regulatory, or third-party payer issues.
The most valued aspect of membership is the ODA's advocacy.
The ODA lobbying efforts are wonderful. They make my job so much easier. All I have to worry about is providing quality care for my patients and not worry about the unnecessary regulations that are trying to be forced on us by the government and other outside agencies.
150 years ago, no one could have predicted what the future would hold for the ODA and the dental profession. Today, as we look back, we take stock of the wonderful advancements we have made. But, just as important, we now look to build on that strong foundation for the future.
I really appreciate the ODA and know that it has helped to protect and advance our profession throughout its history. As a new dentist just starting out in practice, I want the ODA to remain strong so that with the ODA working on my behalf, the future of dentistry in Ohio will be bright and exciting just like its past.
The Ohio Dental Association.
Celebrating our past,
Building our future.